I chose the University of Bristol's Master's programme because I was really impressed by the strength of the academic research from the university. I'm really interested in young people's health, and the department has a special centre that looks at interventions for public health in schools, and that was something that I was really interested in.
The lecturers might be coming from the university, from Public Health England, from the council, so in lots of different professions.
The lecturers are experts in their field, so they're often using the research methods they're teaching us in, or the overall topic is what they do every day. So there's people from Public Health England and the clinical commissioning groups and within the research groups themselves. So you've got a big variety of people.
The degree equipped me well for working in public health now because we covered a lot of research techniques and statistics and epidemiology that meant I could just go straight into this job and already understand the basics.
We learned a great deal about statistics and epidemiology and health protection, and I use that in my everyday work.
I really wanted to learn and have a good foundation in the research methods, and that's something that Bristol's really strong in. I also wanted to learn about the practical application of public health, and that's something that we learnt about as well in great detail.
Writing the dissertation in the form of a journal article felt like a more practical approach and more valuable in a real-world setting, which I think is a really good part of the Masters.
What I found really useful on the MSc was that we had health protection teaching from professionals from Public Health England.
Within the course, they teach us how to do a health needs assessment, and I've been in my post for 8 months and I've already worked on 2 different health needs assessments.
It's given me the confidence that I've got the core public health skills that are needed when you're working in a local authority or in a central public health role, particularly in terms of stronger quantitative skills, but also qualitative skills. For example, I'm now running some focus groups in the local authority, and I feel that I've developed the skills and experience to be able to do that.
So the MSc gives you both the soft people skills on how to interact with both your colleagues and the public and to get public health messages across, but also the hands-on data analysis skills and epidemiology skills, which I thought was a really nice complement so that you could go out into the workforce and tackle any of the areas.
Employers view this course really positively, and people are working in a diverse range of public health areas. So in Public Health England, in local authorities, in the university and in charities.
I finished the Masters in September and started working at Public Health England in October.
I don't believe I would have got the job had I not had a Masters.
I'm currently working as a research associate at the University of Bristol. I work on reviews of evidence, and I'm looking at a range of different topics, including brain cancer and acute kidney injury.
I'm really enjoying my job, and there's not a day that goes past where I'm not using something from my Masters that's informing what I do.
The MSc in Public Health at Bristol is really broad, so we get to learn about lots of different aspects of public health and have experiences in those. And I think that's really beneficial to employers because we have a breadth of experiences that we can apply to lots of different projects in the workplace. So I think from their point of view is really valuable.
We were really well supported on the Masters programme, both from an academic point of view and in finding future jobs.
The lecturers are really great with their support, hands-on, so if you had any queries you could ask them then and there in the lecture and they would stop and go over things. But also if you had issues with your assignments you could contact them directly over email or set up a meeting to chat things through. And on top of that we also had personal tutors, so they encouraged us to meet with them at least once a term to go through any issues we might have been having.
So I had lots of support from the lecturers on the course, and particularly from the other students. And I also had support from my personal tutor when I needed it.
It has been fantastic, one of the best years of my life.